You can hear me?
Yes, please. Just introduction, please.
Yeah. Good morning to everyone who is gathered online. Before we begin this briefing this morning, let me just take a few moments to mention some practical details. Please do ensure your name and the media outlet you represent are visible on your Zoom profile to ask a question, and we hope many of you will ask questions today, and we will come to you in due course. Please make sure you have a microphone connected or active on your computer as well. Thank you. We will begin in a couple of minutes. Good morning from UN City in Copenhagen. My name is Banu Patnagar. Thank you so much for joining this WHO Europe press briefing today. This is our first of 2024. And let me take this opportunity also to wish everyone a very happy new year. Before handing over to the regional director, Dr. Hans Kluge, this morning to make his opening statement, let me introduce our other panelists who are also here to take your questions. Next to Dr. Kluge, we have Dr. Catherine Smallwood, Program Area Manager in the World Health Emergencies Program here at WHO Europe. And next to her, we have Dr. Mark-Alain Widowson, who heads the High Threat Pathogens team, also here at WHO Europe. So without further delay, Regional Director Dr. Kluge, you have the floor.
Good morning, good afternoon. I'd like to wish all of you a very happy new year from everyone here at the WHO's Regional Office for Europe. We certainly hope for a healthy and a more peaceful 2024. And on that note, I'd like to begin with some positive news. A new study led by WHO Europe has found that at least 1.4 million lives in our region were saved thanks to safe and effective COVID-19 vaccines. Without them, the European region's cumulative known death toll could have been around 4 million, possibly even higher. Our analysis of 34 countries also found that more than 90% of lives saved were people over the age of 60. Overall, COVID-19 vaccines reduced death by 57% across the WHO European region between December 2020, when the vaccine rollouts began, and March 2023. In fact, the first booster doses alone saved an estimated 700,000 lives. Just think about it. Today, there are 1.4 million people in our region, most of them elderly, who are around to enjoy life with their loved ones because they took the vital decision to be vaccinated against COVID-19. This is the power of vaccines. The evidence is irrefutable. WHO's recommendation is for persons at highest risks from COVID-19 to continue to be revaccinated 6 to 12 months after their most recent dose. This includes the elderly, pregnant women, the immunocompromised, and those with significant chronic medical conditions and frontline health workers. Besides COVID-19, the European region is seeing widespread circulation of respiratory viruses like influenza, respiratory syncytial virus or RSV, and measles. When looking overall at the region, we can see that RSV rates peaked before New Year and are now declining. COVID-19 rates remain elevated but are decreasing, and influenza rates are now rapidly increasing. And while this is not necessarily out of the ordinary, we would like to draw your attention to a few trends. As we speak, we are seeing a high intensity of influenza infections in several countries across the region. Health systems should be ready to see a likely surge in influenza cases over the coming weeks. Across the region, the past 2 weeks have seen a 58% increase in reported hospitalizations for influenza and a 21% increase in ICU admissions compared to the previous 2 weeks. Influenza cases increased fourfold between November and December, with 38 countries in our region reporting the start of the seasonal influenza epidemic. As expected, the groups most affected by severe disease are the over 65s and the very young. And we are concerned about reports of localized pressures on hospitals and overcrowding in emergency rooms due to a confluence of circulating respiratory viruses. In addition to COVID-19 and influenza circulation, RSV and other pathogens such as Mycoplasma and measles have caused increased hospitalizations among children. Also, while COVID-19 infection rates are broadly decreasing across our region, this can rapidly change. A new SARS-CoV-2 variant of interest known as GN.1 is fast replacing other known variants. It's now the most common variant being reported globally and is the dominant variant circulating in our region, accounting for 79% of sequenced variants. Though there is no current evidence to suggest the GN1 variant is more severe, the unpredictable nature of this virus shows how vital it is that countries continue to monitor for any new variants. Many countries have reduced or stopped reporting on COVID-19 to WHO, and I cannot stress enough how important continued COVID-19 surveillance is, alongside other circulating respiratory viruses. 13 countries in our region did not report any data on respiratory viruses last week. Surveillance remains our first line of defense to monitor unpredictable respiratory pathogens, be it mutations or new viruses. The COVID-19 is here to stay. The pandemic years taught us a great deal, not least that protecting yourself and others from respiratory infections is a newly accepted way of living. We know how to keep ourselves and others safe, whether from COVID-19 or other respiratory infections. No one knows your risk like you yourself do. What we need to do now is apply that knowledge when and where it matters. This means assessing our own level of risk and our risk to others at every step of our days, and then apply the protective measures that matter most to reduce the chances of catching or spreading respiratory infections. Measures range from staying at home if sick, hand and cuff hygiene, and adequate indoor ventilation, to mask wearing in certain settings, such as hospital or crowded places. In this context, we all need to use our own judgment when taking steps to protect ourselves and others around us, based on an individual assessment of risk. Importantly, as we learn to live with COVID-19 and other respiratory viruses, it's absolutely vital for vulnerable populations to stay up to date with their COVID-19 and influenza vaccinations as recommended. As we put a difficult 2023 behind us and look forward to 2024, I am deeply concerned that health is slipping from the political agenda and that we are failing to address the ticking time bomb facing our health and care workforce. As health systems come under strain, we are reminded that we may be unprepared for anything out of the ordinary, such as the emergence of a new, more severe COVID-19 variant or a yet unknown pathogen. In closing, I encourage everyone to show gratitude, patience, and solidarity with the dedicated health workers who are doing their utmost best under difficult circumstances. And I ask policymakers and healthcare leaders to show demonstrable support for the health workforce, not with words, but with actions. Thank you.
Thank you very much, Dr. Kluge. And now let's move to the Q&A part of the briefing. As I said, please do raise your hand to ask a question, and we'll happily come to you. And I see Lauren from Euronews has raised her hand. Hi, Lauren. Good to see you. Happy New Year. Or please do ask your question.
Hi, can you hear me?
Yes, go for it.
Hi, thank you so much for doing this. I don't know if you want me to put the video. Okay, there we go. Hi, yeah, I'm Lauren Chadwick from Euronews. Thank you again for this press conference. I was wondering, in terms of influenza, we've seen that they've been very high in several EU countries. Even in Italy, I think they're reaching some of the worst numbers in several years. So I was wondering, is this expected as we come out of the COVID-19 pandemic? And then you talked about health slipping from the political agenda, Dr. Kluge. So I was wondering if you could give an example of kind of how that's happened. Thank you.
Thank you very much, Lauren. So for the first part, we'll go to Dr. Marc-Alain Widderson, who has been leading on this study. So Marc-Alain, please, you have the floor.
Yeah, no, thank you, and great question. I mean, these viruses are very unpredictable, as we know. So when we can say, was this expected, I think, no, we can never, we should always expect the unexpected with these viruses. They mutate, they drift, and they cause these spikes in disease. I think what we can say is that, firstly, to expect the unexpected, but secondly, we are now in this post-COVID phase. It's possible that people haven't been exposed to influenza quite as much during the lockdown periods and the other measures that were implemented during the COVID pandemic. And there are still some people that are susceptible. But basically, this comes back to the message that these are preventable cases. This is a preventable surge that's happening in Italy and elsewhere, and really comes back to the importance of vaccination. So I think it's unexpected in the sense that we always expect the unexpected with these viruses. It's possible that there's an effect from the lockdown, but difficult to quantify that, but really emphasizes the message that people need to get vaccinated against flu to prevent these preventable surges in hospital capacity.
Thank you so much, Marc-Alain. So I think your second question there, Lauren, was around what the regional director mentioned about health slipping from the political agenda. So Dr. Kluge, please, if you'd like to elaborate.
Thank you very much, Laura. You know, we have seen this before. In pandemics, we see a cycle of what we call panic, followed by neglect. And of course, policymakers have a lot of pressing issues. Usually there is one big issue which dominates the political agenda, which for the last 3 years has been health. But countries face a cost of living crisis, energy crisis, a lot of, unfortunately in our region also, war and defense issues. So it's so important that we really keep health at the top of the political agenda. And the key word here is security. More than half of the world's population lives in countries which will have elections this year. There's still a lot of uncertainties, and we have seen that health may not be everything, but without health there is nothing. And that's why the current negotiations by the member states on the pandemic accord is so important, because the key issue still to be solved is the whole issue of equity in access to vaccines, diagnostic therapeutics, not only in the pan-European region, but also globally.
Great. Thank you so much, Dr. Kluge. I see there's another hand raised from Stefano. Stefano, please unmute yourself and ask your question. And please also do let us know which outlet you represent. Thank you.
Hello, hi. Can you hear me?
Yes?
Yes. So I'm a contributor to the European magazine Vox Europe. I have a question for both Dr. Kruger and Ms. Smallwood. So there is a lot of emphasis on the power of vaccine to reduce the incidence of COVID and hospitalization, mortality. But I know that even antivirals, mostly the host-targeted antivirals, can be very powerful tools to reduce the impact of a pandemic, mostly at the beginning, while vaccines are still under development. And I have the feeling that the European Union is not really investing a lot in antivirals development and research, also the member states. So I would like to know if you think that in order to be prepared for future potential pandemics that I hope will never happen, the global community and the EU mostly should invest more money into the development of these antivirals.
Thank you so much, Stefano. It's actually a very important question. We'll go to Dr. Kluge first, and then Dr. Smallwood will come in as well.
Thank you, Stefan. You mentioned the European Union, and linked with the question of Laura, the positive thing is that the current presidency of the European Union, the Belgium EU presidency, has put as a cross-governmental priority to put health and social affairs at the top of the agenda of the new Commission. So this is very promising. On vaccines treatment, we always say we have to look at a toolbox. So there is not one single measure which will do the trick. So your question is very, very valid. And for the specifics, I will give to Dr. Smallwood.
Yeah, thank you very much, Stefano. And indeed, we talk a lot about the vaccines, and there the power of the vaccines is to reduce the severe disease and the severe outcomes from COVID-19, not necessarily the incidence. Antivirals, of course, are a strong part of WHO's recommendations, and WHO has specific recommendations on antivirals, in particular for the oral antivirals that are available to be delivered at an early stage of disease. And that's particularly true in the case of patients who develop COVID-19 and who are at risk of developing severe disease. Now, as you said, there are complexities there, and particularly complexity now as we have multiple viruses circulating, and people in the early stages of disease might not even know which virus that they're infected with. So in that case, there are some challenges related to the deployment of antivirals, both in terms of how they're deployed through primary healthcare settings, but also in terms of cost, distribution, availability, and sometimes regulatory requirements that countries need to put in place in order to have them imported, potentially as new medicines that are not regulated under the legislation that exists already. So very important point.
Thank you, Dr. Smallwood. I see we have a question in the chat here from Le Monde. And Julien is asking, what method was used to estimate the number of lives saved thanks to COVID vaccines? as it always seems difficult to know what would have happened if something had not been done. So if you could elaborate a little bit on that, Marc-Alain.
Great question, and we certainly don't want to look as if these numbers are coming out of nowhere, they're coming out of a black box. It's actually quite a straightforward methodology, which has been used by other groups as well in her previous publication, wherein basically we back calculate. So we look at the number of deaths that are happening that were reported, and then we use what we know about how effective the vaccines are at preventing deaths, and there are very high quality studies that have looked at that. And we take those estimates, accepting that they may be a little uncertain, and that's incorporated in the model as well. And then we sort of say, well, if this many people died with this much vaccine, then how many people would have died if there had been no vaccine? In other words, the people who survived that were vaccinated, how many of those would have died if they had not been vaccinated? So in effect, in a nutshell, it's a back calculation, looking at observed deaths, applying what would have happened if the people in that age group had not been vaccinating, and then assuming how many additional people would have died. And we do that throughout the whole of the COVID period through a modelling approach, which I won't go into details.
Thank you so much, Marc-Alain. Dr. Smallwood, you'd like to come in as well.
Yeah, I'd just like to add that this is a contribution to a growing body of evidence around the impact that vaccines have had during the pandemic. And as Marc-Alain noted, this is an update to a previous study that we led that was published in November 2021 that looked at that first year of vaccine deployment. And we've updated it now to cover the different vaccine periods, but also to cover the booster doses that were administered. But other groups have come out with very similar studies, some of them using different methodologies. But the bottom line is always that vaccines have saved millions of lives, particularly in people who are older, and that they continue to save lives. So the impetus for people to go out and seek vaccination, if they're eligible, is still there.
Thank you so much, Dr. Smallwood. I will I've got some more questions coming in the chat. I'm just going to stay on topic a little and then come back to Erin Prater. But let's take a question from Johanna Monte from RTBF. Happy New Year, Johanna. She's asking, what is WHO's recommendation for mask wearing, or the public to wear masks or not in hospitals and in sort of healthcare settings? So if I can maybe go to Dr. Smallwood first on that one.
Yeah, so WHO's recommendations haven't changed in terms of mask wearing in the past year. At the community setting, our recommendations are that individuals take a decision based on the level of risk in which they're set. So mask use can be recommended in areas that are confined, that are crowded, where there is insufficient ventilation in place. And as the regional director noted in his statement, this has now not become a mandate, but it relies on the individual judgment. Masks protect oneself from various pathogens, including COVID-19, but they also prevent, for example, if I were to be ill, they also protect others around me. So this is very much an issue of personal judgment. When it comes to health facilities, this again depends on the area and the potential mandates that are applied at the local level. But there we have a stronger recommendation that masking is indeed recommended in health facilities, especially where there is circulation of COVID-19.
Thank you so much, Dr. Smallwood, for explaining that. We have a question here from Erin Prater from Fortune magazine. I'm going to bring in one of our panelists who's online, who's on standby to take some questions around vaccines. Dr. Siddhartha Datta is our regional advisor on immunization. And Erin is asking, can you elaborate a little bit on the issue being posed by the measles outbreaks that we're seeing across Europe? Over to you, Dr. Datta.
Thank you, Banu. I hope you can hear me well. And thanks, Erin, for asking that question. I think if we take a quick snapshot on what's happening in the European region and measles, between January to November last year, as for the reports for which WHO is available with us, we have seen around 42,000 plus cases of measles, which is around 45-fold more than what we have seen in 2022. Very concerning indeed, but we should also be aware of the fact that there had been a 3% drop in the measles coverage between 2019 to 2022. Obviously, the COVID-19 pandemic had an impact on that. What is important is, as you have heard from our regional director say, that health should remain a central focus. This is a very clear indication of why it should be. The measles vaccines we have, they are safe, they are effective, have been used for years now. They've been able to prevent so many deaths and diseases in the WHO European region. The member states are doing so much in terms of outlining what needs to be done. There are campaigns happening, there are catch-up vaccination programs on board. We are extremely glad that the member states are putting all these efforts. What is important, and at this point of time, is to understand where these measles cases are happening. Which are the communities where they are being affected? And I think this will really tell to the health system that where the focus has to be in. The partners are also playing, together with WHO, are playing an immense role in supporting our member states. It's this whole conjoint effort we strongly feel will be more needed in 2024 and beyond. We just cannot let this entire success story of measles being contained or so many countries having eliminated measles in the WHO European region just go loose at this point of time. So I think this effort of measles and together with sustaining a high routine immunization coverage will be very much pivotal in 2024 and beyond. Thank you.
Thank you so much, Dr. Datta. I'm going to take a question here now that we received in advance from TAS, and it's going to go to you, Regional Director. The journalist wanted to know whether the sort of latest pandemic, the COVID-19 pandemic, now that we've had a little bit of distance from it, has influenced the way we make prognosis about any coming pandemics or health emergency events. So, over to you on that one.
Yes, to start with the positive, the answer is yes. Actually, it's yes and no. The yes is, it has been unprecedented, the speed with which, for example, the vaccines were developed. And as we just noted, how many lives have been saved? In this region load, 1.4 million at least. Also the resilience of the healthcare workforce, local solidarity, young people helping elderly people. But the answer is also no if we speak on one of the bigger issues, the whole issue of equity in access to what we call medical countermeasures, like the vaccines, diagnostic, therapeutics. That's one. A second one is still the fueling fake news, misinformation, disinformation. For example, on the pandemic accord. And that's why it's so important that member states get to an international agreement, a pandemic accord. And the big misunderstanding is that this pandemic accord will shift away the sovereignty from countries to WHO, which is absolutely not the case. What the pandemic accord aims to do is to tackle some issues like much quicker exchange of information, of data on clinical trials, and on sharing also the different medical countermeasures. A big lesson we learned is the concept of regional resilience. The regions themselves have to become self-sustainable in terms of, for example, manufacturing, clinical trials, etc. And that's what's happening, for example, in the African Union, where the heads of state made a decision to establish and strengthen the African CDC with the transfer of mRNA to South Africa. And that's something that the pan-European region has to scale up as a pan-European region to become stronger, more self-sustainable, always in solidarity with the rest of the world.
Thank you. I think Dr. Smallwood would also like to come in.
Yeah, and just building a little bit on the regional director's remarks, we're currently engaged in two big streams of work. Just today, in fact, we have our technical advisory group that are meeting to help us develop what we're calling Preparedness 2.0. And this is ultimately aimed at ensuring that for the next pandemic, we build on the lessons from the previous one. And that extends to what Dr. Kluge was referring to in terms of the medical countermeasures, but also talks about how we collaborate to collect and assess and analyze surveillance data, how we use big data, how we use genomic sequencing, how we use modeling. Suddenly people became very well acquainted with things like nowcasting, where we actually have to use modeling techniques to understand what's going on right now. We also, in addition to having to invoke a whole new discipline of infodemic management, we've also understood that in terms of applying pandemic response measures, scalability, smart measures, the ability to act early in order to avoid having to implement more stringent measures later on have been critical, but also prioritizing measures. When we think about schools, WHO's recommendation was always schools are the last to close and the first to open. So prioritizing measures during a pandemic is also critically important. And bringing all of that together, we are working directly with our member states in the European region and beyond to revise and update pandemic plans. So this is a critical way of ensuring that what we've experienced in the last pandemic can be documented and included in the pandemic plan for the next one.
Thank you, Dr. Smallwood. I'd now like to bring in another panelist joining us online, because we have been talking a little bit about pressures on health systems. It has been mentioned already. The influenza season is leading to some of those pressures. Dr. Natasha Azzopardi-Muscat is the director for our Division of Country Health Policies and Systems. And Dr. Azzopardi-Muscat, do you think these current health system pressures that we are seeing are the result of the health workforce crisis? And if so, what do we need to be doing to address that crisis, as the regional director has raised?
Thank you. So, as you rightly said, the pressures that we are seeing at the moment are driven mainly by the confluence of these respiratory tract infections. In the European region, which is the oldest region in the world, and particularly in some countries that do have a high proportion of frail older persons, a respiratory tract infection may often lead to a general deterioration in their conditions and be a trigger for hospital admission. One of the questions which we are sometimes asked is, but if we know that our health system's capacity is not being sufficient in times of crisis to meet these demands, why don't we just create more hospital beds, create more ICU beds? And over here, the answer is that the main bottleneck that our health systems are grappling with is, in fact, the finite and the shortages in our health workforce in Europe. Some countries particularly face shortages in the nursing profession, a crucial profession, when we are talking about, for example, emergency admissions and also care of people with these medical admissions within our health system. This is something which is WHO Europe already almost 2 years ago we saw coming during the pandemic, and we published our flagship report, which drew attention to the fact that not only do we have shortages, but that in many countries our health workforce is aging and needs to be replenished. Having said that, unfortunately, some health systems are struggling even to retain the current health workforce because of the pressures that they are under, and also they don't find that they have enough people to recruit within their own countries. This can be partly a demographic issue, with young people being fewer, can partly be an issue of choice, that the current working conditions that health professionals face, not only in terms of remuneration, but in terms of the conditions that they work under, are no longer so competitive when compared to other sectors of work. In a crisis as we have at the moment, it's also possible that the health workforce feel even more tired and pressurized, And therefore, we need, as our regional director said, to take all steps to do everything possible to support the health workforce, to recognize that many of them may be putting in, for example, extra shifts to cope with these pressures, and to be patient and supportive. But we also need to continue to work with our health systems, and we do have now a framework for action which was unanimously adopted at our last regional committee to make sure that we don't continue going from one crisis to the next, and that we plan for more sustainable solutions, see what the needs are, and find the creative solutions to meet them. Thank you.
Thank you so much, Dr. Azzopardi Muscat. I'd like to go back to the Lives Saved report that we're also speaking about today, and just bring in Marc-Alain one more time, because the country data, and we will share this report with everyone afterwards, there is country-specific data, and it appears that, more lives were saved in some countries, or there was a greater reduction in mortality in some countries than others. And I'd love for Marc-Alain to explain why that might be the case.
Yeah, no, great question. And I think when countries look at that, they may be wondering the same thing when the report comes out. And a lot of this comes down to the timing and the coverage of vaccination. Obviously, the more you vaccinate and the quicker you vaccinate in a country, then the more lives you're likely to save. In particular, the countries some countries rolled out within 30 weeks of the pandemic beginning. They had over 95% coverage of the elderly, where we know is where most of the deaths occur. So countries that vaccinated early and vaccinated at high levels were likely to see much higher deaths averted than countries who were vaccinating a bit later, and perhaps less completely over time. They may have reached a high level, but it depends on how quickly they reach that high level. So those, I think, were the two main critical factors that affected the results between countries. There are other issues as well, like the number of elderly in different countries does vary, so therefore the number of population at risk will vary as well. But the vaccination timing is the most important, and coverage. And of course, it comes back to the most important message here is that by vaccinating people, we prevent deaths, and to do so quickly, and as to cover as many vulnerable populations, at-risk population as possible. So countries that didn't reach all their at-risk populations would have then have had a higher mortality, and therefore fewer deaths averted. A slight extra point is that what we saw, which was really interesting, is that vaccinating just before the Omicron wave with the booster was really saved 0.7 million deaths. And so what we're talking about when lives averted with COVID vaccination, we have the primary course that happened at the beginning, during the Delta wave. But really what we're seeing now is the booster vaccinations that are really continued to save lives. We know that vaccine wanes. We know that vaccine becomes less effective over time. So really what we're seeing in this report is really the effect of repeated booster vaccinations, and not just the effect of the primary vaccination course, which occurred early in the pandemic. And this really reiterates WHO's message that people need to get boosted, particularly at-risk groups need to get boosted annually.
Thank you so much, Dr. Widdowson. I know Dr. Dutta might have something further to add. So, Dr. Dutta, you have the floor.
Thank you, Banu. So just to build upon what Marc-Alain has mentioned, obviously the primary vaccination course was dependent on availability of the vaccine and the quickness of the system to put in a strategy to reach out to the wider population group. And I think this initial saving that we have seen, that you will read in the report, is much lower than the booster effect, what we have seen, which has come out. A couple of elements on these that we can all reflect on when the member states are now working towards integrating COVID-19 into their routine vaccination. What is critically important for the health system is to see that they can put in a strategy in place, a system in place, to identify the vulnerable population group in our in the entire vulnerable groups in the population. This will be critically important to reap the benefits of the COVID-19 vaccine and save even more lives or the disease moving forward. Because the booster effect, as you have heard from Mark Elaine, was much higher than the primary course vaccination when it was implemented. Now, moving forward, as you have heard from the regional director, WHO is suggesting that you vaccinate either a 6-month or 12 months based on your vulnerability status from a last vaccination. This will not happen automatically. The system need to put in place, this system need to adopt strategies to identify them and to vaccinate them. I think this, while we are really grateful for the power of vaccines, for the vaccines to become a vaccination and also to reap the benefits of the vaccine, these lessons learned and also these numbers that we are publishing today will be of critical value, both for policy as well as strategy moving forward. Thank you.
Thank you so much, Dr. Datta. And I notice no more questions online. Give journalists another few seconds to raise their hand and ask a question if they like. Otherwise, I would very much like to thank all of our panelists today, the Regional Director, Dr. Kluge, Dr. Smallwood, Dr. Widdowson, Dr. Datta online, and Dr. Azzopardi Muscat. As ever, if you need further information, we will share the report and the text of the statement with all journalists very shortly. But if you have any further questions, please do email us at eupress@who.int. So with that, we are closing today's press briefing. As always, stay healthy and take care. Goodbye.